Hey guys, my name is Alexandra Yonda and I am a current MS4 at McGovern Medical School. Today I will be giving you all an introductory lecture on the different imaging modalities used in medicine. You will see x-rays, CTs, ultrasounds, and MRIs for the rest of your career, whether it be in the classroom, on your step exams, on clinical rotations, or in your future practice. Today, my goal is to provide you with a basic understanding of how these imaging techniques work, so you can ace your exams, impress your attendings during rounds, and use imaging to its fullest potential once you all are the doctors in charge of ordering scans for your patients. So let's get started. The oldest and most commonly used imaging modality is the conventional radiograph, also known as an X-ray or plain film. The X-ray was incidentally discovered by Wilhelm Röntgen in 1895. He later went on to win the Nobel Prize in Physics for the discovery in 1901. An X-ray machine requires three main components. First, a source, the X-ray machine, will produce the X-ray. A detector then records the image. We used to use film as the detector, but now we typically use a photosensitive plate. Finally, a processor produces the image. Originally, chemicals were used to process the film, and hard copies of the radiographs were stored in file rooms. Now we use digital readers to process images from the photosensitive plate and store the images on computer systems like PACS, which stands for Picture Archiving, Communications, and Storage. X-rays are a form of electromagnetic radiation with a short wavelength and high energy. In order to initiate the X-ray, electrons emitted by the cathode interact with the metal anode, leading to the emission of an X-ray. This X-ray collides with electrons in the human tissues. Various tissues have different densities and therefore different capabilities of stopping these X-rays. What reaches the plate produces the image that you see. There are 5 basic densities that can be seen on X-ray. From least dense to most dense, they are air, fat, solid and fluid, calcium, and metal. The first 4 are naturally occurring and can be seen in the chest radiograph on the right side of this slide. You can see that the air inside the lungs appears black. When looking at an X-ray, this is called hypodense or hyperlucent. The calcium in bones such as the clavicle appear more white or hyperdense. If this patient had metal in his chest, such as a pacemaker, staples, bullets, or shrapnel, it would appear solid white or opaque. When looking at any type of radiographic image, it is important to use proper vocabulary for white and dark. We will continue to make note of the proper radiologic vocabulary throughout this presentation. Some advantages of the conventional X-ray are that they are relatively inexpensive and widely available. Additionally, the advent of the portable machine makes them a very convenient tool in many different situations. Disadvantages of conventional radiography include the limited range of densities that can be produced. Additionally, the image produced is a sum of all interactions that occur, which leads to the generation of a 2D image from a 3D patient. Both of these do not allow for the level of detail that other modalities can provide. Perhaps the greatest disadvantage is the exposure to ionizing radiation. Radiation exposure can cause free radical production and cellular mutations, which can predispose patients to malignancy. Tissues that have high turnover rates, such as bone marrow, intestinal epithelium, and thyroid, are much more sensitive to radiation. For this reason, X-rays should be used with caution, particularly in children or pregnant women. And these patient populations, if possible, use ultrasound or MRI. The next imaging modality we will discuss is computed tomography, also known as a CT or CAT scan. The CT scan was developed by Sir Godfrey Hounsfield in the early 1970s. The idea behind the CT scan is to collect many 2D slice-like images that can later be processed into 3D images. This is done by rotating an X-ray beam with multiple rotating detectors around the patient. This allows us to gather many images a few millimeters in size from all different angles. The final product is a stack of all the individual slices that can be scrolled through from top to bottom, the axial plane, left to right, the sagittal plane, or front to back, the coronal plane. Sir Godfrey Hounsfield went on to win the Nobel Prize for the CT scan in 1979. When compared to X-rays, CTs have a much broader range of densities between which they can differentiate. Density of tissue in CT is measured in Hounsfield units. Hounsfield units range from -1,000 to +1,000, and different tissue types can be better visualized in different ranges of Hounsfield units, as shown in the chart on the right side of this slide. The greater the number of Hounsfield units, the more white the image will appear. When discussing a CT, the proper words for more white are increased attenuation or hyperdense. Things that are more black have decreased attenuation or are hypodense. The collection of such a vast amount of data from many different angles, as in a CT, allows for the images to be processed in different ways after they are acquired. One example of CT post-processing is windowing. Windowing is the ability to review the same image in different pre-selected ranges of Hounsfield units for better visualization of the tissues of interest. You can see on the right side of the slide the same axial section of a patient's chest in 3 different windows: the soft tissue window, the lung window, and the bone window. This allows us to visualize different organ-specific pathologies that would otherwise be missed. For example, the lung window always should be used for thorough inspection of the bronchioles. However, if you tried to review the ribs without changing to the bone window, you might miss a fracture. In real life, this is like changing the brightness and contrast on your TV. Additionally, the images can be processed into axial, sagittal, or coronal planes, as shown in the figure on the top right. Finally, volumetric data gathered can be reassembled in order to form a 3-dimensional reconstruction. This gives a more realistic image and helps the physician visualize the patient in 3D. Click on this link to see an example of a CT abdomen in the axial plane. You can see what it would be like to really scroll through up and down on this CT. There are many advantages of CT, including that it is fast and widely available. A full-body CT scan, from your head to your toes, can be obtained in under 10 seconds. This makes it a great modality during acute cases. Additionally, expanding the grayscale enables differentiation of more than the 5 basic densities seen on plain film. Some disadvantages of CT are that it is expensive to both the patient and to the hospital. The machines are not portable, unlike X-ray machines. Additionally, the exposure to ionizing radiation is much greater than an X-ray of the same body segment. Whole body radiation dose, or effective dose, is measured with the scientific unit, the millisievert, or MSV. As an example, the effective dose of radiation from a chest X-ray is 0.1 millisievert, compared to a CT chest, abdomen, and pelvis, which is 17 millisievert of exposure. This means that in terms of effective dose, one CT chest, abdomen, and pelvis is equivalent to getting 170 chest X-rays. Let's go ahead and move on to magnetic resonance imaging, or MRI. MRI is the first modality that we will discuss that does not use X-rays. Instead, it utilizes potential energy that is stored in hydrogen atoms within the body. The human body is on average 60% water, which is composed of 2 hydrogen atoms and 1 oxygen atom. These hydrogen atoms can be manipulated using a strong magnetic field and radio frequency pulses, causing them to release energy in the form of radio frequency signals. In an MRI scanner, the main magnet creates a strong magnetic field. For most scanners used in the medical field, the magnetic field strength is between 0.5 and 3 Tesla. For a little perspective, the Earth's magnetic field is around 50 microtesla. This magnetic field is permanent, meaning it is present even when the machine is turned off. Inside the magnet, there are 2 types of coils. Transmitter coils transmit the radio frequency pulses that excite the protons in human tissues. Receiver coils collect the echo that is given off by these excited protons. These signals are received by the scanner and sent to and processed by a computer. The end results are highly detailed 2-dimensional and 3-dimensional images. As previously mentioned, the hydrogen atom is the main player in an MRI. There is 1 proton in each hydrogen atom. This proton is positively charged and constantly spinning, which creates an electrical current. Every proton in the human body has its own magnetic field. When a patient enters the machine, all of the individual magnetic fields of the protons align, either parallel or anti-parallel, with the much more powerful magnetic field generated by the MRI machine. It is now that the transmitter coils I mentioned on the last slide send radio frequency pulses. These displace the protons. When the radio frequency pulse is stopped, the protons realign with the main magnetic field. This process gives off energy, which is detected by the receiver coils. In MRI, different pulse sequences can be utilized. Each pulse sequence has a preset repetition time and echo time, as well as other parameters that allow for the desired signal to be acquired. The pulse sequences you will use most in medical school are T1 weighted and T2 weighted. We will not go into the physics of these now, but it is extremely important for you to know what is bright in each. The most important difference is that water is dark on T1 and bright on T2. An easy way to determine if a scan is T1 or T2 weighted is to look at a structure that contains water, such as CSF, either in the brain or spinal cord, or just look at the bladder. If the fluid is white, it is T2 weighted. Let's practice on the images on this slide. Here we see an axial slice of brain. In the first image, on top, the CSF inside the ventricles is dark or has decreased signal intensity. This means it is T1 weighted. In the second image, the fluid inside the ventricles is bright or has increased signal intensity. This means that it is T2 weighted. On a T1 weighted image, fat, hemorrhage, proteinaceous fluid, melanin, and gadolinium contrast are bright. On a T2 weighted image, fat, water, edema, inflammation, infection, cysts, and hemorrhage are bright. Of note, certain signals can be suppressed or canceled out with post-image processing. As an example, fat is often suppressed. Suppression can help identify the composition of certain structures as well as gain better visibility of surrounding structures. While T1 and T2 weighted are most common, many other sequences such as FLAIR, STIR, and DRE are available and will be discussed later on in your education. Of note, gadolinium is the most common IV contrast used in MRI, compared to iodinated contrast used for CT. Structures that enhance with contrast administration appear bright on T1. Go ahead and click on this link to see an example of a knee MRI. Take a few seconds to appreciate the level of detail, particularly in the muscles and ligaments. Again, this is just to give you a quick sample so you can recognize MRIs in the future. Note that on CTs, bones appeared white or hyperintense, whereas here on the MRI, the bones appear dark. This will be a good rule of thumb to help you differentiate between the two. This trick will be handy, especially on your neurology rotation. On a brain scan, take a look at the calvarium, or the bones of the skull. If they are white, you are looking at a CT. If they are dark, you're looking at an MRI. You can also check the CSF, which might make this easy. Some advantages of MRI are that there is no exposure to ionizing radiation, making them safe in children as well as pregnant women. There is much higher contrast and therefore better visibility between different soft tissue types. For this reason, MRI is the best imaging modality for muscles, tendons, and ligaments. Disadvantages of MRI include that it is expensive and not widely available. It cannot be used on patients who are claustrophobic, as the patient is enclosed in the machine for anywhere between 15 minutes to over an hour. Finally, the magnetic field generated by the machine can affect ferromagnetic objects inside of the patient, such as pacemakers, aneurysm clips, bullets, etc., as well as ferromagnetic objects inside of the imaging room, such as scissors, scalpels, and oxygen tanks. Therefore, patients with metal implants should not undergo MRI, and all metal should be removed from the imaging suite before imaging. Of note, aneurysm clips, cardiac stents, and pacemakers are starting to be manufactured as MRI compatible. Our next modality to discuss is ultrasound. I am sure most of you have seen an ultrasound machine before. Ultrasounds have many applications, including but not limited to transabdominal or transvaginal to look at a developing fetus, transrectal to visualize the prostate, or transthoracic and transesophageal to evaluate heart structure and function. Let's go over how the technology works. Ultrasound uses acoustic energy to generate images. First, a probe or transducer sends out high-frequency sound waves. This same probe will later receive the reflected sound waves, or echo. An attached computer converts the echo to images. If most of the acoustic energy is transmitted, such as in fluid, it will look black. On ultrasound, this is defined as sonolucent, hypoechoic, or anechoic. If most of the acoustic energy is reflected, such as in bone, it will appear gray to white. This is defined as sonodense, echogenic, or hyperechoic. When looking at different organs on ultrasound, you should always look in both the longitudinal plane, also known as the long axis, as well as the transverse plane, which is perpendicular to the long axis. Go ahead and click on this link. Here's an example of a video of transthoracic echocardiogram, or TTE, which uses ultrasound technology. Notice that the sonographer images the heart in both the longitudinal and transverse plane. Ultrasound has the advantage of being a real-time imaging modality, so you can actually see the heart beating and the valves opening and closing as it happens. The Doppler effect is a very useful feature of the ultrasound that can be used to determine the direction of blood flow. An ultrasound can generate a colorimetric representation of the directionality of blood flow by determining whether the returning echo is of higher or lower frequency compared to the original sound wave. If the echo has a higher frequency, it is moving towards the ultrasound probe. This is represented by the color red. If the echo has a lower frequency, it is moving away from the probe. This is represented by the color blue. This is a great tool when evaluating the vasculature for peripheral or central vascular disease, emboli or thrombosis, aneurysms, stenosis, venous insufficiency, etc. It is also useful in assessing valve function. On the top, you can see a screenshot of a color Doppler ultrasound of the common carotid artery and the jugular vein. Below is a screenshot of a transthoracic echo, which shows blood flowing within the heart. Some advantages to ultrasound are that it is relatively inexpensive and widely available. The machines are portable and provide real-time imaging ability. Additionally, there is no radiation exposure, so they are the preferred modality in children and pregnant women. Some advantages of ultrasound are that some disadvantages, of ultrasound are that they cannot penetrate bone. Any sound wave transmission beyond the bone will be blocked, and the structures will not appear on the image. Similarly, gas-filled structures can decrease the utility of ultrasound. In obese patients, body habitus can impair the image quality. Finally, good ultrasound acquisition is heavily dependent on the skill of the operator. Finally, we will discuss nuclear medicine. Nuclear medicine is founded on the understanding that certain radioisotopes concentrate in specific body tissues. For example, iodine concentrates in the thyroid, glucose concentrates in the brain, and phosphate concentrates in the bones. Knowing this, radioisotopes can be attached to pharmaceuticals, and their uptake can be measured with a gamma camera. An example of this is positron emission tomography, or PET scan. In this imaging technique, glucose is fluorinated to create fluorodeoxyglucose contrast agent, or FDG. FDG can be administered to a patient and will be uptaken in tissues with high metabolic demand, such as malignancy due to their increased consumption of glucose. This makes PET scan a great tool in the diagnosis and treatment of cancer. It aids in detecting recurrence of known cancer as well as distant metastases, as shown in the image on the right. This patient has extensive metastatic melanoma. Of note, organs with a baseline high metabolic demand, such as the brain and heart, will show increased tracer uptake that is not pathologic. Additionally, the FDG contrast is cleared by the kidney and excreted in urine, so the kidneys and bladder will also show increased tracer uptake, even in healthy patients. A normal PET scan with uptake is shown on the left. As you can see, the brain and the renal system show increased tracer uptake, which is completely normal. These are the references used in today's presentation, and that is all for today. I hope you found this lecture to be helpful, and if you have any questions or would like to know more about radiology, please feel free to reach out to Dr. Nix or to me. Have a great rest of your day.